Hello and welcome everyone. It's Dr. Walter here. Another Thursday, 12 noon. This is episode 10 of my live Facebook show, and I'm super excited to bring on today's guest, and I'll introduce him in a moment. It's a family chiropractor. Before I do that, I always like to share the purpose and the vision behind this show. And the purpose is to really inspire people to discover chiropractic if they haven't, and also give hope to people if they've lost hope when it comes to their health condition or health problem, and give them an option that is different than what they're perhaps used to if it hasn't worked for them. And the other thing too is to help increase trust in people's ability to be aware that there's an inner healing power within them, and if they can acknowledge and tap into that with the right guidance, they can get the health benefits that they're really looking for that they haven't found in other ways. So that's what the show is about. And I'm excited that this is the 10th one. And I actually have Dr. Ryan on the split screen right there. Hey, Dr. Ryan, welcome on the show.
Thank you, Walter. Happy to be here.
Awesome. Dr. Ryan French, I'll just give you a little intro. He's a good friend of mine. He's also a personal mentor of mine. And I can honestly say I've learned a lot from him in the past 10 years that I've known him. And truly blessed, from all the things that I've learned from you, Dr. Ryan. He's a family man, 4 children, husband to his wife, Suzanne, coach, writer, a mentor, chiropractor, you name it, we got all in one package today. So Dr. Ryan French, tell our viewers, I always like to introduce to our viewers, so they get to know who you are, your practice. So tell our viewers the kind of practice you have, what makes it unique, and who do you see in your office?
Thanks for having me, Walter, and I'm happy to be the 10th episode. That's my favorite number, so that's my lucky number too. It's perfect. We have a family chiropractic practice in Bolton, Ontario, so just a little bit north of Brampton, about half hour north of the Toronto airport. And it's just that. It's a family practice. You can come in on any day and see anybody from 4 days old to 97 years old. Is our oldest person right now that we take care of regularly. And our mission in that office is really simple. It's just to give people an opportunity to be healthier. And we use the specific scientific chiropractic adjustments to achieve that. We inspire people with by educating them on a regular basis, by holding them accountable to things that they want to do with respect to their health. And it's a unique setting. Yesterday I had somebody say to me that I go to a lot of professionals, but this is the only office where I feel like everybody I talk to really cares about me. Mm-hmm. And I think that's unique. So I have 2 other doctors that work with me, Dr. Darren and Dr. Joe, and they're absolutely fabulous. And right now we have 3 chiropractic assistants, Lindsay, Lisa, and Lily. They're a mouthful to try to say their name all at once, but they're a great team. And everybody just works really hard to make the patient experience a positive one. So, and I love working there.
That's awesome. And I've been to your office many times. So I can attest to all that you just said. It's a great office up there in Bolton. So, chiropractic it's pretty amazing what chiropractic is and what it offers to people. And not too many people understand or have been told the principles of chiropractic healing. So to dive into that, let's open with this question. A lot of people in the public tend to see chiropractic as perhaps a way to get pain relief or treat a certain pain condition. And not everyone goes to a chiropractic office for that, especially if they've been referred by a family member, but a lot of people in the public perceive it like that. But why should someone go to a chiropractic office to get checked, at least if they have no pain or no quote-unquote health problem?
Yeah, chiropractic is good for people. When you look at it, we tend to complicate things over time. It's very simple. Your brain controls your entire body through your back. And the healthier your back is, the healthier your spine is, the healthier your body will function. Chiropractic never started out as a method of treatment for any kind of, pain or disease. It was a method of just allowing the body to return to a state of ease, to return to a state of balance, a state of harmony, a state of wholeness. And then sometime in maybe it was 1950s, 1960s, insurance kind of got a hold of the industry and said, we need to have certain diseases that you're treating in order to qualify. And so, they seem to pick the easiest ones like back pain and neck pain and headaches and things like that. But the truth is that the extent of, the effect of a chiropractic adjustment is as far extending as the influence of the nervous system. And there isn't anything within the realm of human physiology that doesn't involve, the nervous system, the integration of information through the nervous system, the function of all the different body parts are all controlled and coordinated by the nerve system.
Mm-hmm.
Now, if you think of somebody super healthy, just think about what their posture looks like.
Yep.
And then you think of somebody who's really ill and think about what their posture looks like. It doesn't take a great amount of knowledge to understand that your structure influences the function of your body. And so we just go on a more detailed analysis and analyze the spine segment by segment in order to understand, or to assess the influence on the nervous system and maximize that so that that person's body can work better. One side effect of that would be that if it works better, it tends to have less pain. But that's not necessarily the goal of chiropractic care. It's to help your body work and heal better rather than just to, get over a symptom or a treatment of a disease.
For sure. That definitely makes a lot of sense. So when someone comes in with, let's say, some kind of health problem or arthritis in their spine, it's been there possibly for a long time, what kind of things could lead people to that state of dis-ease? Like what kind of things throughout their life can cause that?
Yeah, I like your distinction of the dis-hyphenated ease. So, I said earlier when the body works better, you used to be diagnosed with ease. Just the body's working the way it's supposed to. And dis-ease was when the body's not working the way it's supposed to. And then that hyphen gets taken out and it turns into disease when the body starts to reproduce cells at an unhealthy rate or reproduce unhealthy cells to create illness and disease over time. So you say if somebody has a problem that's been there for a long time, the only thing that kills us is stress. And there are variations of the kinds of stress that people get, whether it be emotional stress, whether it be like a toxic stress, whether it be a physical stress. And we can get those all at once or over time, right? It's easy for everybody probably listening to understand that, if somebody fell down a flight of stairs, they probably would be able, would have a problem that needs to be fixed. In chiropractic, we use the term subluxation. So subluxation is what a chiropractor adjusts to allow the nervous system to work better. And so it's easy to get that with a fall, but you can also get it with an accumulation of stress. So whether it be, we're sitting at a computer right now, which is okay for the time being, but if we had to sit here 8 hours a day, 5 days a week, times 10 years, there's an accumulation to that stress. So whenever there's an outside stress that exceeds your internal resistive capacity, your body breaks down. That's why people who are fitter, who have better flexibility, more muscles, they're able to withstand stress better than somebody that doesn't have those things.
Makes a lot of sense for sure. And sometimes people they may not even consider seeing a chiropractor just because of preconceived notions or myths. So what kind of things would actually stop someone even before stepping into a chiropractic office? What kind of misconceptions have you heard from others?
Well, I think I've heard all of the typical things that all stem from really a lack of understanding of what chiropractic is, and even more important, what it's not. A few weeks ago, I had a family doctor say to a potential new patient that they just weren't sure that chiropractic was for them. And the patient said they still wanted to come. And when they came, I did a thorough assessment. I did a full nerve scan. I did a set of x-rays. I gave them a full detailed report. And they took that back to their family doctor. And the family doctor called our office and asked, do we oftentimes x-ray a patient? And I said, yeah, if required, we're going to take a picture. And they said, I've never heard of that before. Like, what are you looking for? And so I invited the doctor I didn't have time to chat at that point. I invited the doctor to have a conversation, and everything that I told her on the phone, she had never heard of before. And so the challenge is that the people that have typically been leading the healthcare charge, which has been the family doctor, most times their education in chiropractic is even less than what any of my chiropractic patients know, and is really related to what they hear maybe on TV or in the news. And of course, in every healthcare profession, there's always going to be events that people don't want to happen. You know, sometimes you'll adjust somebody and they're sore afterwards, and that can happen. Just like if you went to the gym and you worked out hard and you were sore afterwards. I don't think anybody's denying that kind of thing can happen. The challenge is that when people make decisions about their health without understanding the importance of the integrity of the nervous system and spine, and if they got that, they would do everything they could to get their family to a chiropractor.
Definitely, absolutely. So we talked about stress, and a lot of adults understand how stress affects them. But can stress affect young people, like kids, infants, even babies? Is that possible? And have you seen that?
You know, it's very interesting. So the short answer to that is yes, absolutely.
Yeah.
Because there are multiple kinds of stress. So as an infant, the stress, I was talking to a young mom today. It's her first child, and I was explaining to her, I was doing a pelvic analysis called the Webster technique, which is specifically designed to analyze the integrity of the sacrum, sacral area. So the sacrum is the bottom part of the spine, where the tailbone is, because the ligaments that attach to that area also attach into the uterus, and the shape of that pelvis determines the shape of the uterus. And so what happens is, if you end up having a subluxation at the bottom of the spine, you end up also having an effect on the shape of the uterus, which is the house that your baby's living in. And so a lot of times what we'll find is that if a baby has stress in utero from either being caught, sometimes they're caught with an arm up, sometimes they're caught with a leg up, sometimes they're stuck in a transverse position or a posterior position. Sometimes the cord is wrapped around certain body parts and there's not enough room for them to move around to free themselves. Almost always that can be corrected by just giving the body more space. And the big way you do that is by correcting the sacral subluxation.
Yeah, for sure. So I know my wife, we just had a baby 3 months ago, Valentina. So she was under care frequently with chiropractic, and she sees Dr. Dimitri Sokolov in Markham. She did amazing with Webster technique. So throughout her whole pregnancy, she did phenomenal. It was really at the end where she had a lot of back labor, but she literally got adjusted like the day before, she gave birth. So it works quite well. Have you seen that technique work with, I know we don't do baby turning, that kind of stuff, but have you seen if a baby comes in or a mom comes in with a baby in breech position or transverse position, have you seen it actually result in proper fetal position?
So the answer is yes.
Yeah.
It used to be called the breech technique or breech turning technique. And the reason they called it that was because that was the one thing that they could observe happened after they did the adjustment. Mm-hmm. And then it was called the in utero constraint technique. And really all it is something that allows the body to work better. And when the body works better, the pregnancy is more likely to progress as expected. And so we have around 30 times now where somebody was told that they that they were going to have to have a C-section because the baby was in a breech position, and those 30 times that after we did that adjustment, that the baby was allowed to freely turn and they were allowed to have a vaginal birth. Mm-hmm. There are 3 cases in my 18 years where they came in and they were breech and they didn't turn. Mm-hmm. And there are a number of different factors involved in that. One of the things that we think, not for sure, is really involved is when they have a shortened umbilical cord. And so the umbilical cord, of course, is the thing that attaches the baby to the mom to allow nutrients to come in and waste to come out. Yeah. But if that umbilical cord gets caught and there's not enough of the umbilical cord to go around, if it's a shortened umbilical cord, sometimes it's safer for the baby to stay in the breech position because there's less tension on that umbilical cord. So in 2 of the 3 times that the babies didn't turn, there was a note right on the birth notes that the umbilical cord was about 8 to 10 inches shorter than would be normally expected. So can you control for all factors? No, but it certainly works.
Yeah, I've seen the same. It's not as many. We have a lot of but definitely 3 or 4 miles from either transverse or breech into the proper position and prevented C-section as well.
Yes.
So how soon should a newborn get checked?
Well, I mean, I really check them right away. So my own children, I checked right after they came out. The nervous system develops in such a way that as soon as certain reflexes are triggered by the birth process, the development starts. And so there's a major amount of development that happens in those first couple days. And so I always check all of our newborns and all the people who are patients of mine. I typically will either go to the hospital or to their home to check the newborn within those first couple of days of birth to make sure that that spine and nervous system is clear. But, and I've heard and read research that maybe upwards of 80% of newborns have a subluxation in the upper neck. I can't say that that's necessarily been my experience. My experience has been that it's less than half. But that's still half of the time where you can do something to help that baby be healthier right from the very start. And a baby's adjustment, a lot of people think, oh my gosh, like you're checking a newborn, they're so fragile. And I say, you're right. That's why you want somebody who's specifically trained to deal with it, And so a newborn adjustment has the pressure that you would use would be kind of the same amount of pressure to be used to blanch the end of your fingernail. It really is almost imperceivable. So this morning I adjusted 2 children while they were asleep, and both of them stayed asleep. So a child's adjustment probably is a lot different than what you picture when you're visualizing a chiropractic adjustment. But if you ask me sort of timing wise, I would say the sooner the better, for sure.
For sure. And, sometimes I'll even have some moms in my office. They're just a little bit hesitant to bring your newborn or even the maybe 3 or 4 months old for a checkup. How can we ease their fear when it comes to that? Or let's say we're talking to a friend or family member and we recommend to get their kids checked. How can we ease their fear as a mom or a dad?
No, I think a big part of it is having a very high level of certainty ourselves when it comes to checking children. Your practice is often a reflection of you. I have 4 children. And when I started to have kids, that's when I started to see a lot more kids in practice. Obviously I became a lot more comfortable, and you have to have a level of knowledge where you can relate. And I can't ever empathize with a pregnant mom because I've never been there.
Yeah.
I can sympathize, but I can't empathize. Having said that, I paid very close attention during our births. I say our with my wife and I, but we had 4 very, very different pregnancies, 4 very different births, 4 very different stories to tell. And not any one of those individual stories defines the person. One of the biggest challenges with a new mom is there's so many people offering opinions that you don't know what to listen to, and what they need is just somebody who's willing to listen, who's willing to respond when they're ready, and to go from there. And so all of my moms that I take care of through the pregnancy, I have the conversation with them about what they want to do after birth, but I don't ever tell them what I think. I don't ever give them, what I think is best, because they're going to get a lifetime of that from their parents and other people who've been parents and whatnot. So I think the best way to foster that is make the knowledge available. Things like this. Write articles, do videos, take video of the baby being checked and adjusted so the parent can see what that looks like. Yesterday I was checking a newborn who's 5 days old, and what amazed me was I was checking, and then I looked up, and we have a semi-open concept adjustment area. So when people are sitting on the other side, they can't see anything. But this time they were making sure they could see. And it was a line of people just observing. They were so interested in what it looked like to see a baby get adjusted. And these are people who are in my office all the time, who already know that kids get adjusted all the time. And so it was fascinating to me. And they just marvel in awe at how lucky that baby is to get that start at life. And they're also incredibly interested, because even somebody who's been adjusted for a long time has a hard time picturing their head what a baby's visit would look like. And so they're all excited to see what that looks like. So even having opportunities like that to show people, I think that over time it'll just become more obvious to people how that process works and why it would be considered normal.
That's pretty cool. What kind of health conditions have you seen in infants that have responded well to chiropractic care?
It did cut out for a second there. Did you say in infants?
In infants, yeah, in infants.
Okay. Yeah. So So the biggest thing is you're never adjusting anybody to get rid of a symptom. And I do want to be clear about that. Having said that, what are the kind of things that I've seen them struggle with? So infants typically will struggle with things like whether it be gas or colic, whether it be ear infections, sleep challenges, challenges with the crawling or to walking. Those are the typical things you're going to see in the first year that all respond favorably to chiropractic care. Now, I'm not saying that chiropractic care is a treatment for earaches or ear infections, but I can tell you in the hundreds, if not the thousands by now, of times that somebody has come in with an earache, that when they get adjusted, that it clears naturally. How many children that have come in and they were, have had round after round after round of antibiotics, and they start with their first adjustment, and it's the first time in their life that the infection clears without an antibiotic, or the first time that they don't need to go for tubes, or the first time they sleep through the night and whatnot. Remember, the chiropractic care influences the nerve system. So if you can calm the nervous system down, the nervous system also controls and regulates the immune system, and it plays a massive role in it. And so if your nervous system, and people see this, like, have you ever heard of somebody get super stressed and then they get sick, right? Or they get super stressed and they get a cold sore or things like that? Well, when the nervous system is stressed in an infant, and that's what a subluxation, a misalignment in the neck would do, when you remove that, their bodies return to a state of ease. And when it's in a state of ease, it's able to heal from whether it be the colic or the gas or the ear infections or whatever. And I am not saying that every single kid with colic and every single kid with gas pains is because of a subluxation in the spine. But if they have a subluxation in their spine, they're certainly better off without it than with it.
Absolutely. Makes perfect sense. I know I shared this story with you in our Facebook group with my daughter, Valentina. That one time it's been about two days and she's just stuffed up. She hasn't gone, to poop. And I checked her, adjusted her, and then within like about 10 minutes, she had a massive dump.
Yeah, you're lucky that you had the 10-minute delay. I have had a number of times. I keep an extra shirt at the office for just that. So there are times that you'll do it, and it's literally like licking a light switch, and all of a sudden the shorts fill and whatnot. I learned in my first couple of years of practice, never adjust a constipated baby without a diaper on. Right? Make sure that diaper's on, make sure it's done up tight, because that response happens right away. And I always say to my adults who are constipated, don't worry, I'm not going to adjust you and it comes out right away like that, because you'll have more control. But it does happen with babies well, all the time. If you talk to any chiropractor who's seen kids, they'll relate to you getting dirty at some point in their career, that's for sure.
For sure. And I like the distinction that you said that, it's not that we're treating a condition or symptom, labeled condition in infants. And I think the same goes with adults as well. But the infants one is the one that most people get confused with in the public. And that's an important condition. Basically, what we're doing is like you said, is removing any interference in the nervous system to get the baby's and the child's body to adapt better and heal, which is naturally inherent in them already.
You got it. Anything that increases the health of somebody, they're going to end up having less symptoms.
Yeah,
that's always the case. Like somebody going to the gym and exercising, and they start to sleep better. Well, going to the gym is not a treatment for abnormal sleep patterns. It's just when your body's healthier, it tends to work better, works more efficiently. And that's the same thing. So chiropractic care elevates the level of health of the body, it elevates the level of adaptability of the body. In other words, it can respond to stress more efficiently. And as soon as it does that, the side effect ends up being that they end up suffering with less symptoms. Because remember, symptoms are just your body's attempt at getting your attention to tell you that something's wrong. So like the headache is not the problem, the ear infection is not the problem. It was the inability to fight off the bacteria that was the problem that created the ear infection. So
definitely.
Yeah.
And do you have kids in your practice that have been labeled or diagnosed with neuro-sensory processing conditions like ADD, ADHD, or autism, and how do they respond to chiropractic care?
They respond the same as most people. The challenge in those circumstances is that when somebody is either wired a little differently or their nervous system is incredibly sensitive to outside stimuli. So some people will notice if their child has attention challenges that they respond more to red food coloring. And so if the kid has a red Gatorade, their behavior changes a lot, or sugar or whatnot. So in a nervous system that's extra sensitive to external stimuli, then when you start to adjust them, what you do is you bring their nervous system back into a state of balance, so it's better able to perceive its environment. So and it is multifactorial as well. I think that there's almost always there's always a nerves component. I think there's almost always a nutritional component, and I think there's an environmental component where where there are certain patterns of behavior that they're surrounded with that could be adapted, that could help them. So as an example, 3 weeks ago, I had somebody come to my doctor's report. So when somebody starts as a new patient in our office, one of the things we like to do is take the time to explain to them how chiropractic works, what they could do on their own at home, etc. And it's an extended visit. It's over an hour long. And I invite anybody over the age of 8 to attend. And this little guy was 9 years old. And the mom said he will not sit still. He will not be able to sit through that. I can't bring him. And I said, I understand that in school, they always say that he can't sit still. Would you bring him? And it'll help me to evaluate how he responds to the environment. And all that I did was I had things like this. So this is a keychain of a little spine, but I had him hold it. And then I took it away, and then I gave him a bigger spine, and I had him play with it and adapt. I had him come up and touch the buttons when I was talking about the nerves. I had him come up and interact. And what ended up happening was at the end, I asked him a series of questions, and he demonstrated a level of intellect with respect to the nervous system that even many of the adults in the room didn't get. In other words, how we taught him, his nervous system just worked differently. And as soon as I saw that, I saw potential, then I knew as soon as I helped his nervous system normalize, he'd be better able to adapt to the environment that he's in and be able to learn in regardless of the setting, regardless of what kind of teacher he has. And so already, the teacher sent a note home saying, that he's listening better and he's actually answering questions in class. And that's because, his nervous system has changed.
That's amazing. And he's going to grow and thrive just way better just because of that. That's amazing.
For sure. Yeah. I forgot to also mention how that will dramatically affect the rest of his life. That minor detail. For sure. Yeah.
So we're going to wrap this up. A couple more things.
Sure.
Let's give our viewers and anyone who watches this later some practical things they can do at home to improve, their life in general, or maybe something regarding with their health. So what kind of lifestyle or health tips do you have to share with our viewers?
If you don't have a chiropractor, I would hire one for you and your family for life. I would do that. I don't know how you can expect to be fully healthy if the system that runs everything is not in full balance. So the first thing I would do is I would find a chiropractor. And if you're not sure in your area and you want to find a chiropractor, reach out to Dr. Walter or myself, and we'll help you find one.
For sure.
The second thing is that we know that there are 3 things that rob you of your health, or 3 categories of stress. Many years ago, B.J. Palmer, the developer of chiropractic, he categorized them as the 3 T's: trauma, toxins, and thoughts. And while it seems overtly simplistic, it really is true. Physical trauma, if your body's less susceptible to physical trauma, you're less likely to break down. So it's not rocket science. If you have more muscle, you're more flexible, you have better cardiovascular fitness, your body's going to withstand the day-to-day rigors of life better than somebody who doesn't. Toxins. The worse food that you eat, the air that you breathe, if you're taking medications all the time, or you're exposed to things in your work environment, the truth is that those things add up over time. If you want an example, have 1 beer or have 12. Your body works a lot differently than when you have 12. And so because of the accumulation of it. And then emotional stress is obviously the same way. Everybody listening here has had an emotionally stressful hour, day, week, month. And as those accumulate over time, it breaks you down. And so your level of health, the higher it is, the more resistant you are. It's really interesting. A couple of years ago, I had somebody take all of our feedback forms. So we took feedback forms. It was when we had just passed 450 450,000 patient visits. So 450,000 patient visits, the average doctor will see 180,000 visits in their career. So when you pass 450,000 patient visits, I'd say you at least have a good database of information. And I had somebody take all of our exam forms and say, what did you notice changed since starting chiropractic care? And while greater than 85% of people said that they had less pain, that they woke up less stiff, they took less medication, those are ones I expected. It was, I don't know if it was a surprise to me, maybe pleasantly. Over 90% of people had checked off, I have more energy, I handle stress better, and I feel like I'm in a better mood more often. Can you imagine if they sold a drug that said, take this drug, you'll feel like you're more positive, you'll have more energy, and you'll handle stress better? That would be like the best-selling drug on the planet. And you know what that is? That is a side effect of your body just working properly. So doing everything you can just to get your body working properly would be my greatest health tip.
That's amazing. And the more the healthier, not just our having becoming less external things to get us healthier and more on the internal power that's within us.
You got it.
So let's wrap this up. So oftentimes people may come into an office like ours, and they're not only, we talked about the three different stresses. So they may not only be physically broken or have physical traumas, but emotionally broken, or just have lost hope with their health problem or condition if they're coming in with a health problem. What can you say right now to give that one person or anyone out there that has just lost hope for their life or their condition that they're in? How can we motivate them to just find that hope? What would you tell them?
Walter, I really I struggle a lot with carrying the emotion that I see people walk around with. With understanding that people don't have a vision for their life, and they've lost it. They say that a healthy person has all kinds of ideas of what they want to do with their life, and a sick person just has one thing that they want, and that's to get their health back. And you need to know that your body was designed to function, heal, and recreate from above down, inside out. Health is our normal, natural state. If your body's not getting there, let's find out what the interference is. Let's find somebody that can help you take one more step. I'm not saying everybody's going to turn back into an 18-year-old with boundless energy. That's not what we're talking about. But I have yet to meet a person whose health couldn't be improved from their current state as a result of trying to find areas of interference and removing them. Go to a doctor that really cares. Go to a doctor that your friends refer you to. Go to a doctor that you trust, and give them a chance to talk you through it. If you've never been to a chiropractor before, we're not scary. We're just trying to help. That's the truth of it. And so if you haven't been there, just respond to this. Type something in below this and say, I need some help. Or reach out to me on Facebook or Dr. Walter or any of us that he's interviewed. I know that they are all people who have the heart to serve, and it doesn't matter to me what part of the world you're in. If you're struggling and you want some direction, maybe an answer or a referral to somewhere, please reach out, because there is help.
That's awesome. It's a good way to wrap this up. Amazing. So I want to thank you for your time. Before you go, I want to pop up your contact info here. So let's get this on the screen. Just take a little copy and pasting. Dr. Ryan French, and give people maybe your address and website, how they can find you, how they do this.
You want me to say it? Sorry.
Yeah. Go ahead. Yeah.
It's just cutting out. Is my I'm in the country, so rural internet isn't always the best. I apologize. So I'm at 27 King Street East in Bolton, Ontario, Canada. Our website is www.insideoutchiro.org. And if you want to send me a direct note, you can send it to Dr. Ryan, so DRRYAN at insideoutchiro.org.
And there's your telephone number for the clinic.
There you go.
Yeah, very cool. Great. So I appreciate your time, Dr. Ryan, and had fun doing this. Maybe we'll do it again in the future. So yeah, thanks for coming on.
Thanks, Walter. It's absolutely my pleasure.
Yeah, we'll chat soon.
Okay, bye now.
Bye.